key point in EPMA. This is the European Association for Predictive, Preventive and Personalized Medicine. The most important activity is the promotion of the integrative approach in medicine. It means not only treatment of diseased patients, of course it should be tailored to the person, and this is what we call personalized medicine, but also the combination, if it is possible, to work before the onset of the clinical pathology, of the clinical picture of the pathology. We should do everything in order to trigger the targeted prevention to the persons which are currently not diseased. So, and this is done on the platform of the predictive diagnostic, because how you can treat the patient before you learn anything about them. So that's why it is very important to talk about the elements in the integrative approach. And one element is predictive diagnostics, when you learn more about the individual parameters of the patient, including family history, who were diseased in the family, which kind of predisposition you can expect, and so on. The second step, if the person is not diseased currently but is predisposed to any pathology, you should trigger the targeted prevention. This is very cost effective, and this is what we propose to current healthcare to improve the economy of the system. And the next level, if the person already diseased, you should find the methodology which will be the most effective, the treatment tailored to the person. All these components together create the integrative medical approach called New Philosophy in Medicine. EPMA was created in 2008 in Brussels, because Brussels is our European capital of European countries. The idea was to consolidate different professional groups, because till now you know that there are very big congresses dedicated to radiology, to pediatrics, to omics. Unfortunately, all these professionals don't want or are unable to talk together and to find the common language. And this is one of the most important critical missions of EPMA, to consolidate different professional groups in terms of promotion of the integrative approach, which we were talking before about. And the third mission, probably even the most important, is the dialogue with patient groups. The patient groups should understand that what is going to be done is for them. It is not for me, for our association, for the country or for the Europe. It is personally for each affected patient or patients predisposed to the pathology. And this is a very long discussion, because it includes education on both sides, professional education, that we are well prepared to talk to the patients, and also education in the general population, that they understand what we are talking about and why these measures are beneficial for them. There are at least 5 different healthcare systems inside of the Europe, and it is very difficult currently to find the common platform where we can start to improve at the national level. So this process is definitely not doable at the national level, because first we should learn from each other where are the advantages and disadvantages in individual healthcare system, then consolidate the professionals, and to promote the most effective measures for the advancing of the healthcare. Compared to the USA, it is also the second problem, because the economical models are completely different. And also the mentality is different. So that's why in terms of the comparison and of the consolidation of professionals in healthcare sector, we are talking about long-term process. Don't be too naive to think that it is done in few years. It is not, because we should consider new economical models, advantages of individual healthcare systems, and then elaborate reliable, realistic measures how we can improve and consolidate the measures in global scale. Why? Because you know that currently one of the features of 21st century is the mobility of patients. Today we are in Budapest, wonderful city, I really appreciate. Tomorrow I'm back to Brussels, working on the commission, and so on. The same for our patients. So they move around the world, and frequently they are coming to the medical doctor asking, "Doctor, please provide me with the address where I will be treated at the same level with the same standards," which currently don't exist. So this is the really big challenge in healthcare system, to elaborate the standards for medical services and to treat the patients at the same level in Budapest, in Brussels, in America. The book was a very robust platform to start the consolidation among professionals, because I am the editor of the book, but there are altogether around 60 top scientists and clinicians from 30 countries who were involved in the preparation of the book. The book provides the very important key issues for the consolidation of professionals, which kind of stakeholders we essentially need to create the advanced healthcare, and even economical model, and very, very important ethical issues, how we should treat the relationship between medical doctor and patient in order to understand each other and in order to make it participative for the patients. So the book was prepared in 2008. It is really belongs to the bestsellers of Nova Science Publishers in New York. It was a real platform to create the association, EPMA, which we did in 2008, end of 2008. Now we earn also the results of this book, because people read around the world, they are interested more and more, they start to understand the philosophy. So I think that it was very timely to publish this book, but it was really pioneer in the world. Here you have the National Society of Hungary for Personalized Medicine. The leader is Dr. György Nemet, a highly professional person, very pleasant. We met in Bonn 2011. The preliminary consultations led to the signature of the bilateral agreement between the EPMA, European Association, and National Hungarian Society. And we consider this document not to be the empty paper, but a robust platform for our future collaboration, which include preparation of top science, communication to the patients, collaboration with industry, with governmental structures, because without governmental structures we cannot make the final decision in healthcare sector, and so on. So we are very happy to be here and to collaborate with Hungarian Society for Personalized Medicine.